Cancer of the esophagus is generally on the increase worldwide, and in Uganda, adenocarcinoma type of esophagus is increasing at a faster rate now, surpassing squamous cell carcinoma, reversing the trend that had been seen in 1970s when the latter was the most common. Studies carried out in 2008 at Mulago Referral Hospital indicates treatment of cancer of the esophagus is problematic and mortality rates are very high with no cure in the majority cases. Dr. Siraji Obayo of Uganda Cancer Institute indicates that excessive drinking of alcohol increases the risk of developing a number of illnesses and conditions, including cancer of the esophagus. He says long-term drinking causes irritation and inflammation in the lining of the esophagus.
Since 2002, it has been over the 20 years, it has been gradually increasing. We're not seeing any trend like it's downstaging, it's increasing. And if we're still in a clinic, like you're seeing 20 patients, you find 6-7 patients have esophageal cancer. So if you have 20 people and 6 people have, that's a big number. But this one is not representative of the whole country. You know, these are people who will come to you because they have a problem. So out there must be people who are having this problem, but they have not crossed us.
Using any form of tobacco, including cigarettes, cigars, pipes, and chewing tobacco, will increase your risk of developing cancer of the throat or esophagus. Dr. Siraji Obayo says cancer of the esophagus can occur at any site of the esophagus. This can be mainly in the upper 1/3 of the esophagus, in the middle third, and the lower third.
People who drink alcohol a lot, so the definition of drinking alcohol a lot, you have to define that. So 3 drinks per day, more than 3 drinks per day of alcohol, spirits, okay, is one of the predisposing factors that have been associated with this, because one, it burns the mucosa, it burns the smooth lining, and what actually happens in this when you have problems on the esophagus. So ideally the cells are supposed to be growing normally. The old cells grow and they die. The new cells come and replace. That's a normal way the body has been, God has created the body.
According to Dr. Obayo, carcinoma of the esophagus occurs more often in patients with long-standing exposure to tobacco and alcohol. And human papillomavirus has been implicated in squamous cells carcinoma not only of the cervix but also of the esophagus.
People who smoke cigarettes, you will see like how many cigarettes are they taking. That's the exposure is going to have a factor. So you are just been smoking for a long period of time and the amount of cigarettes. So it also has an associated factor with the disease of the esophagus. So you'll find like the cells will begin growing in a funny way at some point.
There are various types of cancer which are silent in our bodies, and according to our lifestyles today, we are all at risk of being cancer victims. Harris Tembo, WBS, at Uganda Cancer Institute, Mulago.